Hi, Dr. Michael Workman, and today we're going to talk about the different shapes of implants. If you saw our last episode, we talked about the different types of implants, and to review briefly, we talked about the saline implants, which basically are a little bit firmer and we're more likely to be able to feel the ripples in the edge of the implant. The current implant that's used in approximately 70 to 80% of augmentations in America are the silicone gel implant, and the advantage of the gel implant is it just feels much softer, and they give, I think, not only a more natural look but a more natural feel. We're currently using what's called the 5th generation implant, which is a lot of people have coined it as the gummy bear, and what that means is if one cuts the shell, the gel comes out but it goes back in. It's like a gummy bear. It maintains its shape. The other type of implant we talked about on the previous episode was the textured implant, and some implants out there actually have a textured exterior, and basically it feels similar to Velcro, and the theory behind this is that it will decrease too much tissue from growing around the implant. One of the disadvantages of the textured implant, however, is should they shift, one can get a funny shaped breast, and there have been a number of instances where there was some irritation from the shell which actually caused fluid development around it. So today I'd like to focus more on the actual shape of the silicone gel implants, and everything we say is applicable to the saline implants also, but we're going to use silicone just because I got more samples. So there are 3 or 4 different shapes of the gel implants. This here is what we call a moderate profile, and as you can see, I tell patients it looks more like a pancake. It's it's very wide, doesn't have much projection. The next type of implant is what we call a moderate plus, and this particular implant, it's fairly broad, it's got a little more projection, and it's a little bit narrower. Both of these implants had the same fill volume, so we're looking at a 300 cc and a 300 cc. The next shape is what's called a high profile implant, and this is a 300 cc also, and you can see how much narrower this is compared with either of these implants. And recently some of the manufacturers have come out with what we call an ultra high profile implant, and that's this implant here. And keep in mind, these are all the same volume. If I were to take the ultra high profile implant and hold it over the low profile, you're going to see how much narrower this implant is, and you'll see how much more it projects. Now, one of the very critical issues in terms of choosing breast implant size is the width of your breast. Those women that have a wide breast, we tend to put in a wider implant. If one puts in too narrow of an implant, you can almost get a fried egg look. So the corollary of that is, as we go with a higher profile implant, in order to fill out the entire width of the breast, we have to go with more volume. In other words, a larger breast. So for instance, let's say someone's breast is the width such that this particular 300 cc moderate profile fits it nicely, but they want a high profile. Well, to get a high profile implant that is about that width, we have to go with something about like this. And so here I've put a high profile implant on top of that, and I don't know what you would guess in terms of the size of this. This is 300, and to go with one of these higher profile implants, this is actually 455 cc's. And so we've gone from a 300 up to a 455 in order to fill up the width of the breast. But one of the concerns is that many women don't want to be quite this large, and so in order to fill up the size of the breast and go with a high profile, sometimes we end up going with a larger breast than would be optimal for a given patient. and in that case we probably need to go with one of the flatter implants. Another thing I believe is real important is all manufacturers, or the three big manufacturers now, Mentor, McGann, and Sientra, talk about high versus medium and different dimensions. And I think it's important to realize that I've got a Sientra implant here. This is their high profile, and I've got it behind a high profile implant from Mentor and the moderate profile, and I think, to me, they're very similar in terms of the overall shape. So I think that you'll hear one company talking about our